Oh,
There we
you
go.
got her. Thanks, Curtis.
Yeah, no worries.
Okay. Okay, so virtual simulation in nursing. So the program that we have chosen to use is the vSim Lateral Medical. So this is through Wolters Kluwer, which you guys will recognize that name as being one of the many publishers of the textbooks we currently use within the program. And Lateral is one of the frontline producers as well as developers in relation to simulation as a whole. They also are a company that develops Mannequin for simulation, as obviously well as the software, and they also implement specific clinical scenarios for nursing simulations. And so at the front line, they are definitely the experts in simulation and offer really excellent products. And actually in our simulation department here at Red Deer Polytech, we use many of their products. So what is vSim? So the recognition that it's simulation, however, it's in a virtual setting, and ultimately it just recreates clinical scenarios in which healthcare professionals, students are able to navigate those simulations and clinical scenarios. It's, as mentioned, a computer program, and it's really just about creating that opportunity to have that immersive experience and overall just have enhanced learning. It also provides the opportunity to have a central role in what decisions are being made within that simulated scenario. So there's many different ways we can go about using vSim, and this is what makes it so frontier, is when we're using it as an activity or an adjunct to a clinical course or theory or lab, we can devise how we would like to use it and integrate it into the curriculum. So that can look like group work, or it can look like individual work, or it can be specified to an assignment, whether that's a graded assignment or it's more just for a learning activity. So why we chose it is because why the vSim? We did it because we are attempting to look at different ways to enhance the clinical experience. And so part of that was embedding it to actually replace clinical hours that are happening on the floor. So the recognition that the evidence moving forward in nursing education states that there's numerous ways for nursing students to meet specific course learning outcomes. And one of those is the recognition of replacement using vSim. And interestingly enough, there's been a large influx of this evidence just related to obviously our current climate and all of the hardships that occurred as a result of clinicals being postponed or canceled as a result of COVID. And obviously this isn't just specific to where we're at in Central Alberta, it's occurred all over the world. And so this is where the evidence really came in, is because many other post-secondary institutions had taken the opportunity to implement this. And in some cases, what they saw is they were actually able to replace upwards of 50% of clinical time and have those students adequately, if not exceptionally, meet those learning outcomes within the clinical. So the scenarios that we will pick are designed for all learners to meet required competencies that are obviously guidelined by the CLPNA as well as our nursing program. And not only in nursing, they can use it in a variety of healthcare professions. The scenarios will be picked and will be specifically aligned with the course learning outcomes. So by participating in the clinical scenario through vSim, what that means is the learning outcomes related to that vSim will ladder to the actual course learning outcomes. With that being said, it's also important to recognize that the sims that we will be implementing you will already have a level of knowledge that will allow you to apply that knowledge to that specific simulation. So it's not like what is occurring in the sim is going to be based off of information you haven't already been taught or knowledge that you haven't already gained. It is an opportunity for students to navigate a clinical situation independently right through till the end. And what makes this so incredible is that oftentimes in clinical, you will be a part and see these decisions that are being made with clinical scenarios on your sites. However, often you might not actually see it from the onset and follow it all the way through until the very end, and being able to look at what interventions were made and what those interventions, what the impact they were to the client care. And so by participating in the vSim, you are the one who gets to make the decisions regarding the care and what that looks like if you need to reach out to the interprofessional team, and then ultimately follow it through, and then receiving feedback about the decisions that you had made regarding that clinical scenario. So with the benefits of vSim, one of the first things is the active learning. So by the process of taking what you're learning in your adjunct classes and actually applying that knowledge, so you will be taking the knowledge and the skills practice, and you will actually be applying that. And by that, I mean everything that you've obtained up until this point in the program. The other thing that evidence is showing is it actually improves decision-making skills on behalf of students, and it further develops the clinical reasoning and judgment. Now, we have worked with you guys over the last year just in regards to kind of developing what your nursing process looks like, as well as in residential care. The entire course was designed to really help you guys focus on what that looks like. So the benefits of having your assessment skills, your communication skills, and then being able to take that and use your critical thinking and really applying that to what your clinical reasoning is, as well as your clinical judgments. So being able to understand problems or issues, and of course, recognizing concerns of patients, and then being able to factor all of those processes in to ultimately make decisions that are going to assist the client with whatever the issue at the time might be. As a result of navigating the vSims, many students have communicated that they actually felt that their confidence around decision making was increased, and it also created an awareness of just how much knowledge and application of knowledge they were able to achieve. The studies show that with this enhanced knowledge, or there was that enhanced knowledge, if not further so, in demonstrating in their actual clinicals. So by completing a virtual simulation clinical scenario and navigating that process when they're actually on the floor face-to-face in their clinical situations, there was that increased confidence and an increased awareness about how the entire process works together regarding their assigned patients. Overall, nursing students had reported there was a satisfaction in their learning experiences with virtual simulation. And one of the other important things to point out is that it is an augment to the clinical experience. It's not meant to be an added assignment. So like with all simulation, process matters. Students, you guys will be assigned a scenario for the vSim to be completed within a specific time frame. So the way that it has been planned out is over the course of the term, there will be 2 virtual sims, virtual sim days, which means you will not be required to be on the floor in your clinical setting. Your role will simply be to navigate the virtual sim that has been assigned to your group. These 2 dates are going to be Friday, October 1st, and then again on Friday, November 12th. And this decision was made as a team in the recognition that during these weeks, we do have statutory holidays, and we felt it was really important that we didn't want to disjoint your time on the floor. And because of these statutory holidays, you will obviously not be present on the floor. So in replacement, you'll have that day off, and then the next day will be when you're actually going to navigate the sim. So you're not just having a day on the floor and then the next day you're having to do the vSim. And that decision was made just in the best interest to support student learning. carrying on with process matters. So your instructor will provide more detail regarding the format of the following. So we'll be looking at doing, like with every sim, and you guys are aware of this, the pre-brief. So that'll be about half an hour to an hour, and it's the opportunity just to kind of get together with the students, kind of review the learning outcomes. What are we looking to get from this sim? If you've got any questions about the scenario specifically, and review those timelines, and to answer any pressing questions that you as the students might have regarding the process. And then secondly is the enactment. So that's the actual process of navigating the vSim and the scenario. And so you'll be allotted about 4 to 5 hours to be able to do that process. From there, we want it done within that specific timeline, just so it's incremental for all the students, and it demonstrates the same opportunities for each of the students versus it being kind of all over the map. If one group's got 8 hours, another has 5. We really want to take the opportunity to develop a little evidence ourselves to see how this genuinely impacts you guys as an entire group. And so keeping that timeline consistent is extremely important. And then lastly is going to be the debrief, and we're going to be looking at about 3 to 4 hours for that. So you guys were introduced to the method of debriefing for meaningful learning back all the way in PN 252 Foundations 1. You understand the formatting of what that looks like, because both Sam and I had navigated that with you when we did the sim back then. And really ultimately recognizing that it's going to provide that opportunity for each student to have a platform to reflect on what their learning was related to the clinical situation. Next is grading. So as you're aware, as per the course outline, there is no weighted grades for this virtual simulation, so it's not going to affect your overall grade for clinical. It is currently designated as you've either completed it or it was incomplete. And then through the sim module, what you will note is there are actual grades assigned just in regards to pre-quiz and post-quiz, as well as how your progress is tracked. And this information is available for you and you only, but as well as your instructor. So in that case, it leaves the whole situation transparent. And then if the instructor or you feel like there's a specific area that you need further support in, these analytics will help us provide that support to you. It is a requirement within the simulation itself to receive a minimum of 70%. So that's just your traditional clinical grade that we would anticipate you get anyways. However, again, pointing out that 70% has nothing to do with your weighted grades, but it is more of to meet the criteria of the designated completion. You will have multiple opportunities to redo the scenario to achieve this grade by simply incorporating that data that the scenario provides to you at the end to continue to improve your performance. So to touch base a little bit more on that, essentially what that means is as you navigate the scenario, you get that analytic data, you're able to read through that and really reflect on what the program is telling you about the performance or about the decision making or about any judgments. And then it gives you a rationale. So it provides the rationale as to why maybe that was not the step that you wanted to take or that intervention that you wanted to implement at that specific time. So the recommendation with that would be to take that analytical data, briefly reflect on it, and then maybe go back to your literature or some of the resources that are posted regarding the actual clinical scenario, and just kind of maybe update your knowledge to solidify what the analytical data is telling you. And then it allows you to move forward into doing it again. So then you can take all of that learning that you did and all that reflection on learning, and you can apply it again to try to better your grade. So one thing with it, even though there's no specific weighted grades, we will be looking at the level of participation that you demonstrate, obviously, in the sim itself. based on the data that's provided, but also in the debriefing for meaningful learning process. The ability to be able to provide your insights and your own reflections on learning are a key factor to the vSim, or any simulation for that matter, to be effective. So those participation aspects will be considered as part of your professionalism within your clinical evaluation. So how to get started, we will give you tons and tons of support in this. I know that sometimes when you're navigating a lot of new territory, it can at times feel a little bit overwhelming, and we well expect that, and we are well prepared to be able to guide you in any way that is necessary. But essentially, when getting started, you'll purchase the vSim license, and this is going to happen through Red Deer Polytech Marketplace. And of course, when those licenses are available for you, we will be sending out a message. Curtis will send out a message to everybody, informing them with very specific instructions how to obtain that license. And the reason we chose to use that method is solely for the sheer fact that we didn't want there to be any mishaps in what product you purchase, because Lateral offers numerous different vSims, all the way from gerontology and so on and so forth. So we needed to make sure that all students purchased the same software. And so by having Red Deer College purchase it prior to, this would eliminate any issues with that. So once you've purchased the license, your instructor is going to essentially create a class, which is similar to a group in Blackboard, but it'll be within the vSim program. And once your instructor creates that class, a code will be generated, and then your instructor will then send you the group code, so all of you will have it. And then, of course, you know, for some people, we've already got access, but if you don't, what you'll want to do is you'll sign into the vSim, and then you'll just basically you'll put in your access code, and then you just kind of complete the registration. And we've provided the address for that to be able to do that. And of course, this PowerPoint will be posted under the simulation Blackboard unit in 268. So once you've redeemed your access code and you're logged into the point, from my content page, you'll launch the vSim standalone for vSim, and I'll show you a little bit about what that looks like. And this specific vSim is for medical surgical. So on the content homepage, you'll select join a class, enter the class code, and then you just basically join the class, and then everything that you need is going to be in there. And so what I've provided here is a link that will take you directly to a quick start guide, which will outline exactly the steps you need to do to sign in. This student guide is also posted under the simulation unit in Blackboard. So what to expect when you're actually navigating it. So all you're going to have to do is follow the menu that will be located on the left side of the screen. So it's going to have some suggested readings. You're going to complete a pre-simulation quiz just to kind of get an idea of where your knowledge is at prior to beginning the quiz, or beginning the vSim. And what makes this really profound is that when you complete the quiz, let's just say the grade you have isn't quite where you want it to be, then it allows you the opportunity to reflect on the questions from the quiz and go back to your literature to kind of revisit that to enhance your understanding before you actually go into the vSim and start the clinical process. So once you've completed the quiz, then you're going to roll right into the vSim. And then once the vSim is done, you're going to see on that left-hand menu that there is a post-simulation quiz. So in the case of what we're doing for this, we do not want you to complete that post-simulation quiz until you have gone through the debrief. The reason for that is, as again, we are just trying to show the impact of the entire virtual simulation process, which, as we know, the evidence supports that it is the debriefing process that really brings those pieces together for students. And so that quiz will not be completed until you've gone through the debriefing for meaningful learning. You'll see also there is documentation assignments, which will pertain to you if they are assigned, as well as there are guided reflection questions if they are assigned, but these just may be used as part of the processes of DML. And we will provide more information on that as we get closer to the simulation day.
Hey, Brandon.
Student, oh, sorry.
No, you're good. There's just a question in the chat that I just wanted to address really quickly. And the question just says, will the pre-sim quiz be added to the 70% or strictly for our individual learning? I just want you guys to know that this is just a learning exercise.
Yeah.
All right. The 70% there is just to give you a bar to reach to. All right. If you went through this virtual simulation process and really only got 36% and said, man, I'm good, there just isn't any learning to that. And so we had to set a bar for individuals to try and reach to, so that individuals again would continue to go through the process and enhance their learning. So even if you get 0% on your pre-sim quiz, it's only telling you, hey, these are areas you may want to look into. These are areas that may be a knowledge deficit for you, and you may pick up that knowledge through the sim. All right. I really want to ensure that you understand that this is a safe place to learn. This is a safe place to make mistakes, and it's a safe place to grow. All right. I hope that kind of clarifies around why we've put that bar at 70%. All right. Sorry to interrupt, Randy.
No, that was awesome. Thanks so much, Curtis. So student support and resources. So your instructor is going to be your #1 source of support. Just adding that each one of the clinical instructors has attended a orientation educational seminar related to virtual simulation through our vendor. And they will themselves have navigated your clinical scenarios that will be assigned. So they will have full knowledge of exactly how to navigate and what the expectations are going to be within that simulation. And there's a few reasons for that. As Curtis mentioned, simulation is only meant to add to your learning, but it needs to be a safe environment for students to adequately learn. And the way that instructors do that is by being informed about the process of the simulation. So they will be adequately prepared to offer you support while you are navigating the sim, before we begin navigating the sim, and then of course when we do the process of debriefing. The other supplemental resources are the vSim Medical Surgical Student User Guide, and I'll show you a little bit more about that in a few minutes here. The vSim Quick Start Guide, and then there is also a vSim video tutorial. Now, traditionally, the research has stated that it would be really important to assign grades related to this orientation session because this component is what is so vital to your learning. But the recognition in that you guys are already well aware of that. And so we are just asking that before you do anything, that you take the time and you navigate each of these resources prior to your simulation day, so that it kind of gives you that extra confidence. And then it also allows for you to bring forth any questions that you might have in the debrief that your instructor would be able to assist you with. In the moment, if you're having tech support issues, like I myself am designated as kind of a tech support person, and I'd also like to put myself out there as a resource to help you out, albeit there's kind of one of me and many of you, and so that's why we've kind of emphasized the importance of using your instructor as support, but I can also be an added person as a backup if needed. And we've provided the phone support number directly to the vendor. so that you can call them if you're actually having issues with the program. I personally have not heard of any issues, but if something does come about, then you can do that, as well as there is online support in which we have provided the tech support address. Okay, so that'll be it. I don't want to overwhelm you guys with too much information because, again, just like with everything that's new to us, it's really just a process. We're going to take it a day at a time, and as questions come up, you please do not hesitate to ask. Even after this orientation, if you feel the need to reach out to your instructors, Curtis, myself, you know, just know that that avenue is always open to you guys, because we want to make sure that it is, in fact, a really good experience for you and that you're really drawing something from it. Just to add to everything else, so aside from kind of looking at how it's going to augment with the course and impact everybody's learning, we will be sending out at the end of both simulations, we will be sending out a survey or a Google form, and I know many of you are very well aware of this form, and it's solely, I'm just going to stop sharing because we're going to be navigating this scenario. Hi, yeah, so we will be sending out that Google survey regarding, and it is a completely evidence-informed survey, Likert scale, that has been developed with simulation experts all over the world. And so we will be sending this out, and we just really implore that at the time when we do send it out, that everybody just take, as part of the vSim process, take an opportunity to provide your feedback. So you will be able to fill out the Likert scale, so obviously the 1 to 5, but also provide verbal feedback on your experience. And the reason why we're going to be doing that for both of the simulations and not just the entire vSim scenario is that these are strategically placed within your clinical, not only kind of within a month of being in clinical, but kind of a few weeks before you finish clinical. And so we're looking to that feedback to really see the impact on the learning, kind of from the novice acute care clinical standpoint, and then moving along to more of the experienced clinical standpoint, so that, you know, in the future, in using this program, we can really consider your feedback moving forward for whether it's going to be implemented in your next term, as well as for future students within the program. So I will be finishing up that survey and then be sure to send it out to everybody after your virtual simulation day. So before we move into a demonstration, I think I'll open up the floor for questions. Any further pressing questions?
I'll just answer Nellie's question really quickly. Do we have multiple attempts? Nellie, I think you're talking about the pre-quiz and the post-quiz. I do believe you do have multiple attempts to do it, but remember that these quizzes are just to really highlight what we do know and what we don't know, and what we might need to focus on in some of our learnings, right? It's not for grades. It doesn't get put into your 268 grade. This is just a way of us learning for ourselves where our own deficits might be. All right, so you'll have multiple attempts, yes. All right, but just remember that this is all about learning. This is all about growing. This is all about a clinical setting where you can actually attempt to take care of someone, make a mistake, and grow from it, because we can't really always do that on the clinical floor, right? So do it as many times as you'd like, and then take all of that learning back into your clinical settings, right? So we really see a big value in this, and I hope that you guys start to see a big value in it as well. All right.
Is there any other questions out there? Thanks, Alyssa. I'm glad you like that. So in the case of this vSim specific for clinical, it's going to be done alone. And Jaleese, that's actually a really good question. So kind of at the beginning there, I mentioned that there's a few different avenues in which we are able to use virtual sim, but for the purposes of the clinical, we really wanted it to reflect individual experience and individual learning. And so, yeah, we have chosen for it to be an individual experience. However, the debriefing for meaningful learning will occur within your clinical group. And the reason why that's so important that we're going to come together as a group is because everybody's going to have their individual experiences and their own judgments and their own demonstration of critical thinking and how it impacted the decision making within the simulation. And so that learning, when we come together as a group, will really be emphasized by sharing those individual experiences of each of the students. Does that kind of answer the question for you? Good. Okay. Oh, go ahead, Joanne.
Hi, Brandy. So just, I guess, expanding on that. So everyone in our group will have the same vSim, and then we'll individually do this stuff, and then we'll do the DML all back together as our group.
Absolutely. That's
Okay.
exactly what we're doing. And even to take it a step further, just so you guys are aware, it's the entire class that will be doing the same vSim.
Okay,
So
great.
it's not a situation where each group will have their own vSim. Everybody's going to be doing the same clinical scenario for both days.
And then obviously then we could discuss it amongst ourselves if we had thoughts on it or whatever for going forward.
And that's, you betcha. And that is, yeah, absolutely. And that feedback is why it's going to be so instrumental. Really, essentially, you guys are going to be a part of informing this process. What we're doing here, I know it doesn't maybe necessarily seem like it at this current perspective, because I know you guys have a lot going on just with the beginning of clinical and kind of navigating your second year. However, this is really streamlined, this process, by being able to implement this and having the support of our upper management and being able to implement this is really streamlined. We're going to be using these processes to even inform ESAC, which is part of who guides our curriculum and the decisions around what we implement in the curriculum. So it's kind of frontier. And that's why we're really relying on your guys' experience and then, of course, our experience as instructors kind of navigating it with the students to be able, to just really effectively influence everybody's learning is really what it comes down to.
Great. Thanks, Brandy. It sounds amazing.
Yeah, I'm really excited for you guys. I've done some navigation myself, and yeah, it was a great learning experience. I think everybody, whether you are at the novice level as a student or whether you're a clinical expert, I think everybody has something to benefit from this program. And I am really curious, just in some conferences that I've attended related to simulation. I'm really curious to see what it's going to look like 5 years from now, not only just in post-secondary, but even in healthcare settings, like all over the world. So I think there's going to be some fundamental changes. So I'm just really grateful that you guys are going to be a part of this. I'm just going to quickly share my screen again so that you guys are able to see kind of what we have done, if you haven't already navigated it. It's a few weeks ahead. So you're going to see here that the virtual sim is set up in week 4. And so just like with every other one of your Blackboard units, we always like to throw in a little bit of an introduction and a hook and try to provide some evidence around exactly what it is that we're doing for that week. You're going to see here there's a learning path for the virtual simulation, and it is still under construction. Hoping to have everything kind of finalized, obviously within the next week and a half here. And then kind of touching base on those topics again, as well as the time commitment that you're going to be looking within the simulation itself. And then here's where I was talking about that we've embedded the vSim Quick Start Guide for students, as well as the vSim Med Surg user guide. And so by being able to have a look at those prior to the vSim day would be really beneficial. Unfortunately, I wasn't able to embed the actual video, but I will show you exactly where that's located. I did include it down here. So under the supplemental resources in the vSim's My Content, you will watch the resource, obviously the medical surgical video tutorial. I will admit it is a little bit arduous because they do have it broken up into sections. And so there's quite a few sections, which I will show you, in which it'll give you little snippets of how to do this navigation. Again, we have brought forth the debriefing for meaningful learning documents. It is my understanding that a majority of this, obviously, debriefing will occur online, just like we did last year in 252. And so again, you might want to just touch base on some of the evidence around why we are choosing to do this, not only in our simulations, but implementing kind of debriefing for meaningful learning within our clinical post-conferences. As you guys are aware, again, simulation contract submission. So again, this is just tying into what Curtis said about the safe learning environment. So this is a contract between you, your instructor, and the simulation process, essentially, in which we do want you to complete. So we'd ask that you print it off, you sign it, and then whether you send a picture and submit it into Dropbox or you attach the document into Dropbox. We're just asking that you do that, and then your instructors will verify that each one of you have submitted that contract. And yeah, so that's where we're at for now. And then what it'll look like as we build onto it is it'll just kind of incorporate some of those unit learning outcomes and a little bit more about information about the clinical scenario that you will be doing within the virtual simulation. All right, so moving along. So I'll just point out by saying that I am a return user. So this is what it looks like upon signing into the product itself, the vSim product itself. And so once I've selected from, so this button here is My Content. So once you get the license and the group number, you will create a username and password for the product itself. And then underneath your dashboard, which will be your My Content, will list all of the content that you actually have through Wolters Kluwer. And then in that case, you would select the vSim for nursing, medical, surgical. My assumption is that this may be the only content you have, but if some of you are using the online version of textbooks and stuff through here, then those will be listed here as well. So once you get to this area, you're just simply going to click Launch. It's telling me I timed out. And then this is what it's going to look like for you. So keeping in mind, I've just created this as a vSim demonstration. I don't have any students listed in here, and it's also obviously from the perspective of an instructor, but it still allows me the opportunity to show you how to navigate the software. So here you're going to see we've got a couple headers that you can choose from, and in this case, I will go into content. Now where I am here is kind of the menu of the different clinical scenarios. And as you can see, there is a combination of both medical scenarios and surgical scenarios. So we're going to be taking advantage of that and using a medical scenario for one of the sim days and then a surgical scenario for one of the other sim days. And the rationale behind that is that for the students who are situated on a surgical unit, this will provide them the opportunity to see the perspective of caring for a medical client, and then vice versa for the students that are situated on a medical unit, it would provide you the opportunity to be able to navigate a surgical clinical scenario. So when I was talking about the supplemental resources, if you look over here, you can see that they're all listed here. There's even instructor tools that are available for us. And so these are the things that we as instructors have navigated in order to be adequately prepared, as well as attended that learning seminar. And then for you guys, you essentially, these are the things you're going to want to access the day before. So when you click on it, it'll take a few seconds to feed, and then it's going to go right through. It has all the information that you're going to require, right down to how to navigate in, how to sign in, and the entire process of going through each of the components of the simulation. And it is a fairly lengthy document, but you can see that there is a lot of embedded pictures to kind of clarify what the write-ups are about the different sections. So that's the user guide. And then this is the quick start guide. So again, remember, these two things are already posted on Blackboard. So I love this little thing because it basically gives you a snapshot of how to get yourself going and actually into the program. And so it outlines, you're going to get an access code, you're going to use the code, and then walk through the registration process. And then again, on here are the student training videos. And then down here is the actual registration component. So if you don't currently have a Lippincott account, then you're going to create one. And then if you are a returning user, because you may already have some of the online resources, then you're going to do the return user, and then it allows you to directly go to the link. And then it essentially walks you through what that's going to look like to get you started. And the bonus is from our end, we will have everything set up for you. So once you actually get into the navigation component, it's going to be quite simple. And then lastly is the medical surgical videos. So as I mentioned, it is a little bit of arduous because there's 15 parts. So obviously we won't be going through those today, but they can be anywhere from 30 seconds to like 2 minutes for each one, depending. But I think the reason they did it that way is because they wanted to outline kind of each step of the virtual simulation process. So those will be available for you to navigate in order to prepare yourself. And then assignments. So basically, as you can see, the way this is set up from our perspective is we can actually, like if we wanted to use it in a different platform, you know, we can create them for assignments. We can spread it out over a period of time. There's lots of different options available for instructors and students to actually use the product itself. But your assignment will be set up in here. And then any grades you receive, as you can see, they actually call it grade book as well here. And so your grades will be demonstrated here. And this is where your instructor will be able to have access to see kind of where you're at within the vSim. And again, just to mention, you know, you get multiple attempts to better and better your grade moving along. And if, you know, because your instructor will be kind of moderating while you guys are navigating the sim, because they'll be available for you. And if they're noting that, you know, there's consistently low grades, then it would provide the opportunity for the student and instructor to come together to maybe kind of have a discussion about what needs to be done to just kind of assist in the success of the student. And then of course the roster is just everybody. So you can see my name is in here, and the roster is just everybody who's within the vSim group. Before I move into a quick little demonstration, is there any questions so far? Okay. So for today, I'm just going to be going through the Carl Shapiro scenario. So when you open it up, this is what it's going to look like. So it's going to start off just like I mentioned in our brief orientation at the beginning there. It starts off on the left-hand side with your suggested readings. So what's great is it provides you kind of a little bit of a clinical background here. So as you can see, Carl Shapiro is a 54-year-old male, travels frequently. He was seen in the ED at 1:30 p.m. for complaints of chest pain, diaphoresis, shortness of breath. He was treated in the emergency department with aspirin and 2 doses of subling nitro. Chest pain improved with nitro administration. IV infusion of normal saline was started at the emergency department and is running at 25 mils an hour. Ordered labs or values are pending, and the provider wants to be called as soon as those lab results are available. Patient is recovering, receiving oxygen at 4 liters with an SpO2 value of 97%. Chest pain was last rated at a 0 following a second nitro dose, and nitroglycerin patch 0.4 milligrams. He has been admitted to the telemetry unit. Now, the way that this is set up here is you guys can see that these are the required readings that you need to do. So in the case of this, again, because Lippincott, it's American, and so what they're doing is they are actually providing textbook readings from their host of published textbooks, and so these readings are not going to apply to you. So in discussion with Curtis, what we had decided to do is that once the scenarios are chosen and we put them on Blackboard, we are going to research the required readings that you will have to do from the textbooks that you have, and we will put those on Blackboard. So essentially, the readings posted on Blackboard are going to replace these readings. And then going down, and personally, this is probably my favorite part of this entire program and kind of captured me, is you've got diagnostics, pharmacology, and procedures. So as part of the process of doing the sim, you're going to go through all of this and read it. And so for instance, you're looking at the creatinine. And what it's going to do is it's going to provide you with baseline information that is required to know about the lab work that is obviously going to be done related to this clinical scenario. And then once you've read it, or if you choose to print it because you think it's a really great resource, because I just want you to note that it is a really great resource. The only thing I'm going to point out is that there may be some overlap kind of between Canadian lab values and American lab values. However, in the actual lab report that's provided within the vSim, it tells you whether those lab results are within the normal range or whether they are, I should say, high or low. So it would indicate to you that even though the recognition of those specific measurements of the labs may not be within your knowledge, that you know that the lab results are abnormal. And if you're looking to further your knowledge around it, then all you would have to simply do is jump onto Google, and there are numerous resources available out there that do the conversions. And so that's kind of the lab tests. And then for instance, here's medication. So when you're looking at medication, if you just need a quick little reintroduction, little orientation to the medications, then they have such incredible resources on here, you guys, to be able to go back. Of course, you're welcome to use your drug guide as well. But you can see that this is outlined in great detail, including all the same content that you would find in your drug guide. And then lastly, when you're looking at procedures, you can see just how very important, this would be. So for instance, in this case, it gives you the procedures along with some algorithms around what you're going to do when it comes to the specific clinical situation. So yeah, there's definitely, they're going to be done during the 5 hours allotted. And just keeping in mind too, guys, like this isn't Yeah, you're welcome, Corey. This isn't all new information to you. Some of the formatting might be a little bit new because here we're looking at the American Heart Association, but you're all certified in BLS, right? You've all done pharmacology. By the time you're doing this vSim, you've completed pharmacology 3. So by using these resources, again, they're almost like you use them to synergize the knowledge that you already have. And it's just to have a quick kind of dashboard of knowledge that you need in order to do the virtual simulation. So just an extra added resource. And then here you've kind of got the code management as well as DFib, which are all skills that you currently have right now. The reason we're using this one as the orientation is because we aren't going to be using this one as part of the chosen scenarios, and mostly because we're going to be integrating a lot of emergency sim type stuff within 265. Okay, so that's the suggested readings. Any other questions about that? Okay, so then once you feel like you're adequately prepared with that, you would then roll into the pre-simulation quiz. So you can see it tells you how much time was spent on the quiz. So essentially you're going to go through and you're going to answer the questions one by one. Don't feel pressured by the timer. Just for the sheer fact that you want to be able to answer these questions adequately, and then if you do it again, then you're going to be you're going to have a better understanding because it provides the rationales at the end. So when you redo it, you can better and better, and you'll find you'll be able to actually answer the questions a little bit quicker here. So as you can see, which of the following, and I'd like to put in a precursor here that I'm going to rip through all of this, and mistakes are going to be made for the sheer fact that I want to be able to show you guys exactly what it looks like in order to help build on your learning. And I had previously run through this scenario in preparing for this orientation, and I actually ran through it 3 times. Which was such a great experience for myself to go back and do some review, because the first time I did I just went off the fact that, yeah, I'm going to rip through this, and it actually took me till the 3rd time to get 100%, and the impact that it had on my learning, even as an instructor. So I just wanted to put that precursor out there, as well as back when we were making a decision about whether we were going to move forward with this, even Joanne and I had the opportunity to navigate it. And if you guys could have been flies on the wall while her and I were trying to work through a scenario together, I'm telling you, it was the funniest thing. And you would think that we didn't even know what the heck we were doing. And we ended up realizing that once we got through some of the stuff, wow, like look at how even together as a team working on it, how it impacted our process. But we really enjoyed, our time doing it. So basically, it's just going to ask you a series of questions. I believe there's could be 8 to 10 questions. So in this case, which of the following does the nurse recognize as typical, symptoms exhibited by a patient with angina? So you've got, you can select all that apply. So shortness of breath, tenderness over the apical area, substernal chest pain, diaphoresis, pain on inspiration. So in that case, I'm just going to go for shortness of breath, and we'll go with substernal chest pain. And then you hit the arrow. When administering medication to the patient with suspected MI, the nurse understands that morphine has which of the following benefits? So we've got, and again, it says select all that applies: decrease respiratory rate, preload, anxiety, afterload. So let's say we're going to go, I'm going to assume morphine is going to decrease pain. We probably know also, because of the effect on the brain, it's going to decrease some anxiety because it creates that euphoric feeling. Maybe let's go with decreases preload. And you know what? I know morphine affects the respiratory rate, so hey, let's pick that one. when a patient is experiencing angina, the nurse administers nitroglycerin subling at what frequency? So we've got every 15 minutes for 3 doses maximum, 5 minutes, every 3 minutes, no restriction, once only, and then administer the morphine. So in that case, going back to my med knowledge, I may need to look it up, and I'm going to go with that one. Okay, so in this case, we'll disregard this one. I currently don't have the figure, but we would have this available if it was required. So looking at the ECG waveform, the nurse recognizes that the patient is experiencing which dysrhythmia. So in this case, it would be really difficult. So we'd have to pre-provide the picture for you, and we would make sure that all of that is set into play. So in this case, I'm just going to take a guess for now because it's not really relevant. So next, the nurse knows that which factors may increase the patient's risk of developing coronary artery disease. And again, you can select all that apply. And so I'm going to say cigarette smoking. Let's go with family history. You know what? Let's go with all of those just because, I don't know, they seem like they are definitely would be applicable. The nurse understands that aspirin is administered to a patient with a suspected myocardial infarction for which of the following reasons? So, to prevent platelet aggregation, to promote thrombolysis, to improve oxygenation, and to prevent ventricular dysrhythmias. So I'm going to go with this one because, you know, based on etiology of MIs, I know that it's related to clots. So basically, as you're doing the questions, that's exactly kind of what you want to consider. The nurse recognizes that the elevation on the 12 lead typically indicates which of the following. So obviously in this case, I know that it's going to tell us that there's been an injury to the heart. And then which of the following cardiac markers assessed in the patient experiencing angina to determine potential myocardial injury. And in this case, we're going to go, so I got troponin, hemoglobin. So again, when you're looking at those answers, if you're struggling, you can go back to those resources. You can use your textbooks, your lab values, the whole 9 yards to be able to kind of determine what that looks like. And so based on what I know from my lab knowledge, I'm looking at trying to determine what the injury was. And so the recognition that if I look at the creatinine kinase, which would be this one, kind of discusses what the if there's been any skeletal muscle damage or heart muscle damage. So I'm going to go with that one. And I'm officially done. It took me about 6 minutes. Am I sure? Yes. Ah, geez. So according to this, I got 62.5%. So not bad. I definitely passed, but there's obviously some areas in which I need to kind of revisit. And so basically what that means is you're going to go down. You can see here's the analytics that we were discussing. So it tells you what your response was. It gives you what the correct was. And then it's going to give you the rationale. I love this part. This is where you are going to see where that knowledge and that learning is really going to happen, because it's going to make you connect what your critical thinking was in your response. So you're going to go, okay, I chose this answer because of A, B, and C. But when I look at the rationale, I'm able to further my critical thinking related to why I would choose the shortness of breath, as well as you're able to go back to your literature to further accentuate that understanding. It also provides how much time you spent on each of the questions, which I think is also really good. So I won't go through every single one of these. The purpose, again, is just to give you kind of a bird's eye view as to what it looks like, just in regards to how you answered the quiz. So I am done that. So we're going to go next. And And then, okay, going through. Okay, so you can see, sorry guys, I was just trying to figure that out. So first previous, so you can go back and forth to allow yourself some time to really go through each of those questions. And if you need to bounce back to the first page, it allows you to do that. So then basically once you've done that, you are going to be able to roll right into the vSim using this, the left-hand side menu. And when you're ready, you can go ahead and launch the simulation. So again, it's going to provide you with the scenario that you were given at the very beginning. If you want to review the helpful tips, might be worthy to do that just by using the arrows back and forth. And then here, what it's going to show you is an overall synopsis of what your results were. Okay, so obviously in this case, it indicates that you had an error, or you had numerous errors, or 2 errors, or 3 or more errors. And as you navigate the sim repeatedly, you'll be able to see kind of what that score spread looks like. So I feel like we're able to go and see this patient. So when you open it up, you see here that you have their chart or their electronic records, here in this case, electronic health record. And again, it's providing you with all your patient information, gives you a little bit of that psychosocial background, getting to know the patient, right? Just like in the DML, recognizing that when we want to do the patient frame, it isn't all of this stuff that makes the patient, it's all of this stuff, right? And then what you can do is you can navigate all of the different tabs that are available within the electronic health record. You can see we've got some pertinent information because the tabs on the health record are blinking. And what you can see here is that we have been provided some of the blood analysis. And so here they had drawn some arterial blood analysis. So you're looking at your HCO3, and then down here you're looking at sodium, going all the way through to your venous blood analysis for electrolytes and your CBC here, and then your miscellaneous. And then by looking at this, you can see here that it actually provides, as I mentioned, the normal ranges where we're expected this to be. So for instance, with HCO3, it's really looking at bicarbonate. It tests for the bicarb in the blood, and we're recognizing in this case that it's out of the normal range. This one is kind of following right in the normal range, which is a good sign, you know, obviously recognizing that, you know, it's sodium, it's an electrolyte, and it is required for muscle functioning. And knowing from your readings and some of the resources that have been provided, the recognition that hyponatremia, so if you know you consistently have low sodium levels, there's a big correlation to heart failure, a heart failure diagnosis. So ultimately, when you're looking at the different blood counts, you can see, fortunately, they are all following within the normal range, which is great because we're looking at the amount of, you know, hemoglobin, as well as, you know, looking at the red blood cells within the blood, because again, when you're looking at blood cell count, it's also very indicative of heart disease. And then obviously white blood count, we all know, related to immunity. And sometimes when you're looking at something like a heart attack, when there's been extensive damage, the body's natural reaction would be to flood that area. And the cascade immune response would kick in. So you might see a little bit higher levels, as well as you're looking at the platelet levels, which is obviously indicative of clots that are occurring. That could be the precursor to what's happened with Carl here. And then again, yeah, just looking at your creatinine. So this is important because we're looking at electrolytes and we want to make sure that the kidneys are functioning appropriately. And then looking down to just some the miscellaneous. So I already kind of talked about this in when I did the exam, and you can see this one is definitely fairly high. So recognizing again that we may have some issues just regarding the actual muscle damage that may have occurred from Carl's heart condition and his chest pain. And then troponin. So again, just recognizing these levels basically tell you if you've had a heart attack, and the injury again to the heart muscle, and whether or not the chest pain is actually related, because chest pain can be in all shapes or sizes. We know that it's experienced differently for men, women, and this test ultimately helps us to decide if the chest pain was related to heart trouble and if there's the potential that the heart's going to get worse. So just I had that discussion with you just so that when you're going through your lab work, you're able to take that time to influence your own knowledge about why that lab work is getting done. And the reason I say that, you guys, is because lab work is literally one of the first and foremost processes that you're going to have to know as a student, as a nurse, within your clinical setting. Everything is designated around DI, diagnostics, X-ray, as well as your lab work. That's how many decisions are made. And then here we've got the med record. So it's basically telling us that aspirin was given at 12 o'clock, nitro was given at 12 o'clock. We've got, or it was, the patch was applied, that he is able to get PRN nitro. It looks like he had it a couple of times here, and then currently has IV normal saline running at 25 mils an hour. We've got some radiology. So if he did require any radiology done, the reports would be here. We also have the orders. So this is really important. Oftentimes, I might even recommend that you could start off with this, because what you want to ensure is that by looking at these orders, it is informing everything that as a nurse you need to do, as well as what is part of the process of caring for the client. And these orders should all match this, okay? And so it lays it all out. So we've got some telemetry unit orders. So we know, yep, he's got the IV running at 25 mils. Oxygen is currently on to maintain greater than 92. We're doing a continuous ECG and SpO2 monitoring. The activity, so bed rest with bathroom privileges, et cetera, et cetera. So it tells you everything that's going to be happening. And then lastly, if there's any data or feedback from the 12-lead ECG. So that's the electronic health record that you're going to review.
I'm Dan.
Now we're going to begin.
I'll be your primary nurse today.
You can see here the time is down here, any vital signs records. If you need to go back to your electronic health record because you need to double check some information, you're simply going to go back there, which is no different than in a clinical scenario. If you need to call the doctor to provide an SBAR, then you would simply click on this. And then when you feel like you've adequately navigated the scenario, then you're going to do the patient handoff, which is going to allow you to provide the report on your patient. So my first interaction, I'm just going to go in.
I'll wash my hands first. Please state your name and date of birth.
My name is Carl Shapiro. I was born on July 19th, 1967.
Everything matches.
Okay, so I know this doesn't really apply right now. So I think I'll move into safety measures. Or sorry, communication. So do I want to educate right now? You know what, given the current circumstances, I'm feeling like pain could be a bit of a priority. I just want to follow up on this pain because I'm new to this patient. Make sure he's doing good right now.
Do you have any pain?
Seems like it comes and goes. Right now, I'm not in any pain.
Does anything make the pain better?
No, I tried to take it easy, but it didn't help.
Is the pain better after the medication?
Yes,
Okay, and so just an example of how to do some pain assessment. I'm not going to go through everything. And then let's just say something did come up regarding it. You would be able to select educate the patient. So obviously that being a very big part of everything in the nursing process, for every step we take, we are required to educate the patient. So I can further provide that information if needed. So then of course I want to look at, you know, if I needed to ask him specific questions about the current, his current condition, you can select from current illness and it'll provide you specific questions related to whatever is happening with the patient. And then here, you know what, I might actually ask if he is allergic.
No, I'm not allergic to anything.
Do you take any medication?
I take some pills for my blood pressure. My physician tells me it's too high.
Do you have any medical problems?
My blood pressure is too high.
Are you a smoker? If so, how many packs a day do you smoke?
I smoke less than half a pack a day.
Okay, so just me getting some background medical history and kind of getting an idea of where the patient is. And obviously at this point, I don't feel that orientation is a priority here because he has already demonstrated to me that he is lucid and alert and orientated to himself, date of birth, he's able to answer questions appropriately. So I feel confident that I'm going to kind of move into the assessments here. Am I going to do a head to toe? Probably not right now. I see this as being something a little bit later, but currently our major concern here is the heart. So I am going to start by auscultating, and I do want to auscultate the heart.
Please quietly as I listen to your heart sounds with my stethoscope.
Okay.
The heart sounds are normal.
Okay, and then I might roll on down here. And I do note that he requires his 3-lead ECG.
I'm going to attach heart monitor pads to your chest so we can monitor your heart rate and rhythm.
Okay.
Okay, so currently his heart rate is at 82. So now I might
am attaching this blood pressure cuff
check his
so we
blood
can monitor
pressure.
your blood pressure continuously.
Okay.
And I don't know if you guys have noted, but he's kind of changing a little bit. Okay, so we've got a blood pressure. And you know what? I might just, because I know he's got an IV.
Okay. Is something wrong?
No, the site has no redness, swelling, infiltration, bleeding, or drainage. The dressing is dry and intact. An infusion of 25 milliliters per hour of normal saline is running. I'm going to check your pulse here in your arm.
Okay.
The pulse is strong, 80 per minute and regular.
Okay, and we know that he's got oxygen and we need to be maintaining his O2 above 92. So we're
This is a pulse oximeter, which monitors the oxygen level in your blood. It fits snugly around your finger, but should not hurt.
Okay.
He is breathing at 12 breaths per minute. The chest is moving normally on both sides.
Okay. And so then as I carry on feel like I've got everything. So you're welcome. You guys are able to take your time, go through. You know what? I don't even remember. Did I check a
I'm
radial?
going to check your pulse here in your arm.
Do it again, because I can't remember.
Okay.
The pulse is strong, 80 per minute and regular.
Okay, so now I think because I'm doing a focused assessment, I'm gonna leave the rest of these for now, and I just want to have a look at some of the drugs and the IV management. So we access
I don't
that.
feel well.
Oh, okay. Okay.
Something happened to the breathing.
Take note, guys, really quickly here, because technically you'd have to go a lot faster than this, but I want you to look at his heart rhythm, and I want you to note here that his heart rate is gone and he's got no SpO2, okay? So immediately I recognize an emergency situation. So I'm probably gonna wanna go to my interventions or my communication, and in this case, I may call for a code because I recognize I need assistance.
I need assistance in here now.
And then in this case, I am probably gonna
Code team will
go
arrive shortly. Can we help?
here, and I want to recognize that I am calling a code, so I need to perform CPR. Want to get that backboard under, and then I'm probably gonna start the CPR. Meanwhile,
1, 2, 3, 4,
we can
5,
attach the
6,
shock
7,
pads.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Analyzing heart rhythm. Do not touch the patient.
5, 6, 7, 8.
Analyzing heart rhythm. Shock needed. Charging.
Stand clear.
Press the flashing button now. Shock delivered. Begin CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
And then
12,
you guys will
13,
note down
14,
here
15, 16, 17, 18, 19,
that
20,
we have
21,
a heart rate,
22, 23,
we've got an
24,
oxygen
25,
reading,
26, 27,
and we have a
28,
better
29,
rhythm.
30.
So we're gonna stop the CPR, and just to be safe,
Analyzing heart
we'll
rhythm.
see what it says.
No shock needed. Begin CPR.
Okay, but because he has a rhythm, we're going to look at assessments. You may want to just double check. There's numerous, whatever clinical
I
reasoning,
think the patient started
judgments
breathing again.
you can
The pulse
do.
is strong, 90 per minute.
Okay, so now you have completed the CPR. It's telling you that help has arrived. So you can continue by having the debrief within the team. So, oh boy. So as you guys can see, it's telling me here that there's some definite opportunities for improvement. However, with that being said, when you look over here, you can see that there was a lot of clinical decision making that was 100% accurate. Now, it will also tell you that I was in the simulation for 11 minutes, 20 seconds, and it shows you step by step exactly what you did. And so this is when you would take that opportunity to go, okay, what did my process look like? So, you know, and again, so things like this are relating you back to your very first year, your first term, right? So it's building off knowledge that you've developed over time. You've identified the patient, and here's the rationale for it. You listen to the heart of the patient, recognizing that you did a focused assessment because that is the purpose as to why Carl is currently on the telemetry unit. You attach the 3-lead ECG. We needed to do that because that was part of the orders of the physician. We also noted that we wanted to check the blood pressure to make sure that they were within the range. We assessed the IV, which is very important. The IV access is extremely important in somebody who is in kind of this clinical situation, because at any given time, as Carl demonstrated, he could go right back into cardiac arrest. And if CPR is not working and the code team arrives and you need to implement further pharmacological interventions, we need to have that IV access. So you check the radial pulse. So again, just part of the vital signs, we attached the pulse ox. That was great. You check the radial pulse, again, just part of vital signs. And then all of a sudden the patient developed vFib. Immediately when we saw that there was no heart rate, no oxygen reading, we activated the code team. We put a backboard underneath the patient, because we know in order to do effective CPR, the patient needs to be on a stable surface. And basically we started CPR. We got those defib pads in place, assessed the patient with the defibrillator, the AED, delivered a shock. Once the shock was done, we went right back into CPR. And then the patient had return spontaneous circulation. We checked the carotid pulse just to be sure. It was good and strong. They kind of came to, and then they started breathing spontaneously. And then we assisted the code team, and then eventually performed a patient handoff. So I'm not going to be doing that for purposes of today, just and being mindful for the time. And then what it's saying is my area for improvement was you performed CPR during the arrest only 76% of the time it was recommended. So according to guidelines around CPR, high quality CPR includes compressing hard and fast, allowing complete recoil after each compression, reducing hands-off time by minimizing the interruptions, and switching providers every 2 minutes. So that's basically that analytical data. And so at which time, once you completed, then yeah, you obviously would be able to go back in and do the simulation experience again. So Curtis has his hand up, so I'm going to pass it over to him.
All right, and Simin, you have a good question there. Does it give you the right things to do? Well, it gives you feedback on what you should have done, and then you need to go back and say, where would those fixes have happened? So we see here you performed CPR during the arrest only 76% of the time. Well, I need to go back to my data, and Brandy, if you could just scroll back and look at the time stamp. Oh, that's too far. Just when he went into cardiac arrest. You can see at the time at 0839, the patient developed vFib, but we did not call the code team until 9:14, right? And then we started our CPR. So that's where we start noticing where that kind of 25% is, right? So we kind of have to go back and say, I got the feedback, but where would I implement better CPR? And it's a lot of that is just in the timing, right? So it's not necessarily a hidden secret where the right answer is. It's just we need to go back and say, I see, right? He went into vFib at 8:39. I didn't call the code team until 9:14. And really, I didn't start CPR until 9:36. Right? So that's how we utilize this as well in some of our learnings, is going back, reflecting, looking, okay. So just so that helps you along the way.
Yeah, and that's a great way to describe it, Curtis. And I think too, the other thing to note is asking that reflective piece. And so a big part of this process, you guys, is so now I'm sitting here and I'm looking at my data, right? Well, I need to make notes. I might make some reflective notes down on a piece of paper about my process. So even when I did this as I was practicing and preparing for today's orientation, I made myself notes. I made notes about where I went wrong. And then I, as I mentioned, went back and kind of reinformed myself. But not only that, went, okay, in this case, if I noted that at 8:39 the patient developed VFib, then why didn't I activate the code team until 9:14? Where is the gap where I didn't recognize that I should have implemented that code a heck of a lot sooner? And why is that? Is it because I just didn't notice it? Did I not do the right assessments? And so where the learning comes in your own individual reflection is the ability to go, yeah, I totally missed that, but I need to know why I missed that. And so what makes this program so fundamental is that you're going to reflect on that and then take all the information, take the rationales, revisit your learning, kind of brushing up your skills a bit, and then you're going to go in and you're going to have a new, refined confidence in, I know where my knowledge gaps are, and now I'm going to do this vSim again, and I'm going to fix those knowledge gaps. And then what you're going to see is your own personal development and professional development in navigating a clinical situation. I mean, this clinical situation is so common. And even though we do CPR once a year, where it's occurring and what area you're working on, you may not be a part of a code very often. And so it comes down to sometimes when we don't use those skills, we might lose them a little tiny bit. And so because you have done CPR, but you actually haven't implemented CPR, you may, some of those key factors in the timeline, you have failed to navigate, and this will provide you the opportunity to bring it all back and make yourself better at the process. So I'm just going to continue. And then from here, like we said, you'll have numerous opportunities to navigate it, to get to where you want to be. It's not an expectation that you guys get to 100%. However, it would be really great if you could show yourself that you're capable of doing that. Again, the expectation is 70. You can see here that you've got your post-simulation quiz. We're not going to have you do that until you bounce on and you do your debriefing for meaningful learning. And then once you'll leave this open, and then once your debriefing for meaningful learning is completed, you're going to go back in and you'll do the post-simulation quiz, which will be a series of the same amount of questions. And then you'll be able to demonstrate the difference between the beginning, doing the sim, and then after the debrief. And then of course, if anything like documentation assignments are, assigned, it would look like this. Basically, so document Carl Shapiro's cardiac rhythms that occurred in the scenario, document the changes in Carl Shapiro's vital signs throughout the scenario, identify the document key nursing diagnosis for Carl Shapiro, and referring to your feedback log, document the assessment findings and nursing care you provided. So in the case of this, you can see why it's totally normal to be taking notes. It's no different than when you're working with a client. You write down all of your assessment data. You are writing everything down. So you have that in order to be able to do your documentation. But not only that, in emergency situations, you want to be able to quickly and fiercely provide that information to the code team once they arrive on the scene. And so, to be announced regarding the documentation assignments. However, if you wanted to use it for if it's not assigned, and we would talk more about that in the DML, or use these as key components within the DML, we will at some point cover it, but you're also welcome to go through it and use it to enhance your own learning. And then these are some guided reflection questions, and these might be really good as a way. So what we're asking is that everybody take the opportunity to reflect on their clinical experience, vSim experience, prior to attending the debrief, and it, only looking at a certain, a shorter period of time to talk about, okay, what happened, what went well, what didn't go well, and what might I do differently to prepare myself the next time. And these might be really great ways to guide what your individual reflection is looking like. And the reason we're going to be asking you to do that, and like I said, we will provide more information related to this closer to the date. But the reason why it's so important, and this is what the evidence also suggests, is that when you do the simulation and you're on your own, in a regular simulation, usually you have somebody who takes on the role as the observer. So you have a primary nurse, a secondary nurse, a medication nurse, and maybe an observer. So that observer is in fact the one who writes down absolutely everything that occurred in that sim. So then when we come together as a group to do the DML, that observer is then able to outline some of the things they saw that perhaps maybe the person in the session didn't know they actually even had done, or they don't recall. And so that's kind of what helps to navigate the DML. But because you're doing this as an individual experience, writing down your reflection on learning will prepare you so that when you attend the DML with your clinical group, all of your thoughts and feelings are outlined for you, so that as you're hearing other people's experiences, it is not detracting you from your own personal experience. You're still able to learn from other people's experiences and, you know, do the DML process. However, sometimes it can take away from your own. So we just want you to incorporate some reflection in order to be able to adequately prepare for the debriefing for meaningful learning. So yeah, and then once you're done, you basically exit the program and you have completed the vSim. And once you've navigated your post conference, or pardon me, your debrief, then you have finished for the day and officially have used a vSim platform to replace a clinical day. And not only that, you have been afforded the opportunity to begin a clinical scenario situation and follow it through all the way to the end, which sometimes, as I mentioned, in an actual clinical day, you don't necessarily get that opportunity. And that is, again, where evidence is supporting that it increases confidence. It also increases the ability for the student to enhance their critical thinking, which in turn is needed to do clinical reasoning and making judgments. All right, guys, so I'm looking at the time. It's 10 o'clock. I've already taken up an hour and a half. I know you guys have places to be in regards to clinical, so that's all I have to show for now. If anybody has any questions, feel free before we sign off. Yeah, good stuff. Okay, so then if nobody else has any questions, then we will sign off. I wish you guys well.